My name's Marissa. I'm the proud mom of our real-life superhero, Theo. He's 3 years old, and he's diagnosed with a rare brain tumor called pilocytic astrocytoma, and he's being treated at McMaster Children's Hospital. Theo was diagnosed August 5th, 2023. We brought him to the hospital for a double ear infection that was not getting better. He also had symptoms like vomiting. He was very lethargic. He could not sleep through the night, like he was in a lot of pain. So we brought him to the emergency room. He was quickly seen by a doctor. They ordered a CT scan, and we found out that he had a very large brain tumor.
The type of tumor he has actually originates from the optic nerve itself. And so the tumor grows very slowly at the base of the skull, out of the optic nerve, and it tends to cover the area at the base of the skull and then slowly grow up. In and of itself, it would be easily treatable if it were anywhere else in the brain than where it grew in Theo. If you were to try to remove the tumor entirely, you would have to sacrifice the vision. Furthermore, there are lots of dangerous structures that are at the base of the skull, including the carotid arteries, which give blood supply to the front 2/3 of the brain, the pituitary gland, which makes all of the hormones that help a child to grow and develop, and the optic nerves themselves and all of the visual apparatus. And so in a sense, we begin to change our approach to treating this tumor from, hey, let's remove it completely, to maybe we don't need to remove it completely. Maybe we can just control it and treat it more like a chronic disease.
We're lucky at McMaster to have incredible clinical research associates dedicated to helping us get clinical trials up and running. These new therapies are changing all the time, so it adds a sense of promise for families when they look at their future and say, we might have to manage a tumor for years to come. I can also tell them that things are changing and the treatments we have in 2024 might be very different in just a few years. So there's a sense of we're going to beat this thing eventually. And for now, we've got excellent ways to control it.
We are now doing a targeted therapy, and he's been on that for 6 months now. And since he started, the tumor has been stable, so we're very happy with that. He's like the strongest person I know. Everything he goes through, he just bounces back so quickly. Like, he's very resilient. He's so strong. He's so brave. Although he's been affected in ways like his left eye, he's considered legally blind in his left eye due to the pressure of the tumor pressing up on his optic nerves. He also suffers from a syndrome called diencephalic syndrome, which essentially makes it extremely hard for him to gain weight, despite eating like an excessive amount of calories, and that's also due to the tumor and the placement in his brain as well.
Every week we have multidisciplinary rounds where we invite people from the medical specialties, pediatric neurosurgery. We have people from radiation oncology, which is up at the Juravinsky Hospital, joining us every week, and many others, nurses and nurse practitioners, all committed to the expert care of children with brain tumors here at McMaster.
But we don't want him to live until he's 90 with complications of surgery that cause devastating neurological side effects. And so if you think about it, a researcher who approaches a patient is always thinking, how can we improve this? How can we do better? It's about providing a better quality therapy that results in a better quality of life in a patient.
We are very confident that he is in the best care. And, we just, at the end of the day, want him to be a happy kid, which that's exactly what he is. And our family's just taking this a day at a time.